Martin, always great to speak to you. Thanks for your time this Sunday afternoon. So Business 4SA is in favour of mandatory vaccines in the workplace and non-essential public spaces. You're even urging government to move with speed to implement this in light of the detection of the new COVID Omicron variant. That makes sense. In your engagements with government, what has their response been to the suggestion of mandatory vaccine policies?
Well, good afternoon, Anne-Lee. The position on mandatory vaccines is actually very clear. We negotiated several months ago through the NEDLAC structures occupational health and safety regulations. They were published by the Minister of Employment and Labour, which places an obligation on the shoulders of employers to create a safe environment for their workforce, indeed for anybody who comes onto their premises. We know that in these current circumstances, if people are not vaccinated, then not only is there a greater risk of them transmitting the virus, but they themselves are at risk as well. So every employer has to actually assess the risk to their workforce. We've been encouraging employers across the country to look at mandatory vaccine mandates, and we've seen a number of employers and a number of sectors looking at it and already putting them in place. Most of them, by the way, not until the beginning of next year, so that they can persuade and explain to members of their workforce who haven't been vaccinated the scientifically based basis for so doing. And we think we're going to see a significant increase. We've also seen a number of institutions, the University of Witwatersrand, UCT, Stellenbosch, Rhodes and others also applying the same approach, not just, by the way, for their lecturers, teachers, students and employees, but also for any service provider or visitor who comes onto their campus. That is the only way that we're going to be able to create a safe environment, not only, by the way, for our workforce, but for society at large. And in addition to that, as you say, we are now encouraging government and indeed society more broadly to consider restricting access to public places to those who've been fully vaccinated, as we see is the case in many countries around the world, in Europe, in the United States and elsewhere. We think that will drive the levels of vaccination. We think it will reduce the risk of having to impose harsher lockdown restrictions, particularly under the current circumstances when we're all concerned that we're actually into the fourth wave, and it's the prudent, responsible thing to do.
Martin, so the workplace is absolutely at the discretion of employers. That seems rather straightforward. Public spaces becomes a lot more difficult to regulate. You've suggested banning the unvaccinated from taxis. That would be a logistical nightmare in itself. But I want to look at, now that you've mentioned higher education institutions, would you call on the same kind of ban for unvaccinated pupils for access to education?
So when you're talking about pupils, I presume you're talking about of school-going age rather than in tertiary
From 12
education.
to 17-year-olds, yes, absolutely.
Well, we do think increasingly there's a case for that. Obviously, that's a decision, again, for government. All of these policy decisions, other than those that rest either with employers or with, by the way, the owners of physical facilities, because they can determine who comes onto their property or not. We think that it is more complicated for secondary education, but we also know, by the same token, that those above the age of 12 not only are at risk themselves, but put their friends, family and broader society at risk if they're not vaccinated. And it is indisputable, the science at the moment, that those who are not vaccinated are at far greater risk, both in terms of their own health and transmitting the virus to others, than those who are not.
Martin, I completely agree that as part of the social compact, we all have a responsibility towards each other to protect each other by vaccinating. But there are many people who, for various reasons, don't agree. Why do you think that mandatory vaccines are the answer here in South Africa, when so many countries across the world have managed to vaccinate the majority of their population without having to resort to force?
Well, Anne-Lee, I think you put your finger on the problem. Our vaccination rate is, unfortunately, disappointingly low. We have 35% of the adult population that is fully vaccinated, some 25% of the total population fully vaccinated. When you look at very significant, some would argue, draconian restrictions that are being imposed by countries around the world, those are countries with 75, 80% of their total population that have already been fully vaccinated and therefore at much less risk, and they consider it appropriate to be able to force vaccination rates for the balance. In our particular case, if we were having a vaccination, if we had achieved the president's target of 2/3 of the population, adult population at least, having had one vaccination by the end of this year, we'd be having a different conversation, but we're not there. We know that it's going to boost the level of vaccination. It's going to reduce the risk to society at large. It's going to limit the possibility of imposing much harsher lockdown restrictions, which the economy, frankly, cannot afford at all. I mean, we know as a consequence of the restrictions that are now being placed on travel to South Africa by countries around the world, that our international tourism industry is going to be completely decimated. We don't have the financial wherewithal as a country to provide the relief that is necessary, both to businesses and the individuals. This is a quick way to boost vaccination rates across the country.
Martin, the debate obviously, pivots on free choice, but we've been lauded internationally for our progressive constitution. But you think in this instance we're being far too liberal?
No, it's absolutely correct. The Constitution provides that we do indeed have free choice, but the responsibility of society at large trumps the rights of the individual, and that clearly is the case here. We're not saying, by the way, that people have to be vaccinated. We're saying they have the choice not to be vaccinated, but exercising that choice will restrict their mobility, their ability potentially to carry on working. That is their decision and not anybody else's decision.
We are expecting government to make an announcement in the coming days about possible heightened restrictions on social and economic activities. What is your plea or advice to government in the coming days as they consider possibly banning interprovincial travel, the sale of alcohol, etc., the kind of restrictions we've seen over the past few months?
Well, we think that moving away from adjusted level 1, maybe we can consider adjusted level 2, which is where we were previously, is tenable. But frankly, any of the harsher restrictions that you're talking about, whether it be interprovincial travel or indeed the banning of alcohol, will have an absolutely debilitating impact upon not just the national mood, but much more importantly, our fragile economy. The most significant intervention we think that government can make, other than supporting, we're not saying that they need to legislate or regulate for mandatory vaccination, certainly restricted access to areas like sporting events, cultural events and the like, they can do, and we've been having those discussions, is to once again reduce first of all, the number of people who can gather indoors and outdoors. We don't think 750 indoors is in any way appropriate under the circumstances. We don't think that has any impact upon social activity or indeed upon the economy. And the second is they may have to consider extending curfew hours, again, to reduce mobility. Neither of those has a particularly significant set of ramifications for the economy, as I indicated, and can be relatively easily put in place. We've asked the government not to put in place harsher restrictions for the reasons that I've already indicated in terms of the impact on an extremely frail economy currently, which we cannot afford, neither in terms of GDP nor in terms of employment.
As always, thank you for your time. Martin Kingston from Business for South Africa.